Thanks, Carla. Welcome to our annual report. My name's Sylvia Buckingham. I'm the current chair of Healthwatch, Oxfordshire. And the report, in my opinion, is the best we've ever done. And I would like to thank them. Very difficult year for them. I think you'll see for yourself how hard the staff have worked. So I'm now handing over to Ros. Ros Pearce, our Executive Director, who has led this brilliant team. Ros.
Thank you very much, Chair. And welcome, everyone. It's interesting, isn't it? We never know how many people are going to turn up, and we're always very pleased when there's more than one. So you're all very welcome today. I'm Roslyn Pearce, Executive Director of Healthwatch Oxfordshire. And today what we're going to do is we have a short film and a presentation to follow that we're going to show you. The film will be is on our website. So if we have any difficulties, etc., with internet now, then you'll always be able to have a look at it at a later time. Please don't leave us now to go and watch the film. We'd like you to stay around. And after the film and the presentation, there'll be an opportunity for everybody to ask questions, to have a conversation. I like to think of it rather than anything else. So what I'm going to do now is try my technology best and get the film going. So I suggest you get your popcorn, sit back and enjoy. Yeah, got to share my screen first. My name's Roslyn Pearce. I'm Executive Director of Healthwatch Oxfordshire. Our purpose is to hear from people about their experiences of health and social care services, and also to then make sure that those voices are heard by the people who pay for services and those who deliver them. The team adapted amazingly well to the restrictions that were put on us because of COVID, social distancing, mask wearing, being locked down. We developed our use of online surveys, more reach, more work around social media, but we didn't lose touch with being able to actually meet groups and organisations using Zoom, lovely Zoom, but we still kept contact with the groups and organisations that we were working with before. We heard from nearly 8,000 people last year, which was tremendous. We're here to hear from you, from the public, about your experiences. So if you don't talk to us or we don't find you, then we can't do our job. So I'm really pleased about what we achieved last year.
It's really important that Healthwatch Oxfordshire hears from all of Oxfordshire's communities. So we've had to develop different ways of working and reaching out proactively to talk to people. And this is a long process, and it involves getting out there, building trust, getting to know people and working alongside them to really hear what's important to them around their issues around health and social care. So an example of that, this year we've worked very closely with a community group called Oxford Community Action. This brings together Oxford's diverse and multi-ethnic communities under one umbrella. And together we sat down, we developed a project, we designed a questionnaire, we worked with community members to distribute the questionnaire and to really reach those people and hear their voices. So at the end of the project, we also made a film that was taken to the Health and Wellbeing Board by members of the community to get those voices really heard.
Maybe it's more of a cultural thing when you're taught to be toughen up and face the situation and you'll be fine, deal with it.
So yeah, I would speak to my GP, but a lot of people in our community wouldn't do that because there's fear of stigma.
People told us that there were significant barriers to achieving well-being, and those were about the underlying drivers of poor health, and also the feeling that if they turned to some health services, that they didn't represent culturally appropriate support.
I can see it where the resources is, but all these resources are not reaching to our community. Unfortunately, that's why we are now becoming one of the victims of mental health, problems. And I hope the system, will pick up these things and they will do something in the future.
We're now working with community researchers, offering training and support so that they can look at their own communities' issues that they want to look at.
Throughout the year, we worked really hard to listen to and support communities during the pandemic. We carried out several projects asking people to share their experiences of what it was like accessing dentistry during the pandemic or visiting pharmacies during COVID, so we could report back what we'd heard to service providers and commissioners. We also played an important role in providing reliable and trusted information about COVID via our website, our social media channels, and in the early days of the pandemic, we also produced a fortnightly COVID bulletin. We also worked to highlight the digital divide and raise awareness of the fact that not everyone is online, so we made sure that we had paper copies of our surveys and reports. We became aware that new and emerging communities in Oxford were lacking trusted information about COVID in their own languages. We worked closely with Oxford Community Action to translate and deliver a leaflet about COVID in 5 languages to 700 homes in Oxford.
We started by asking people in Oxfordshire to tell us what were the top 3 issues for them around social care. And based on that, we organised several pieces of work, did some surveys in care homes, asking managers to tell us early on how they were coping with the pandemic, and also with family members to tell us what their experiences were of having a loved one in a care home during the COVID pandemic. There was a big problem with access to personal protective equipment, difficulties getting access to testing for residents and staff. Also, there was a problem around information. There was so much information about the situation and levels of infection, and also guidance on how to manage it. It was rapidly changing and they found it difficult to keep on top of. In October, we followed up this work with another survey to find out how things had changed, whether things had improved. Flow of information had improved and access to protective equipment and testing had improved. But there were still problems with residents being able to access health services like GP practices and dentists. So following up from our report, we're going to be continuing to monitor the situation and recommending that health care authorities and care home managers work together to learn from their experiences and to find out what best practices have worked and to recommend those in the future. We also wanted to hear from people who look after somebody in their own home, what we call unpaid carers. So we ran a survey. We heard from 160 people who were looking after somebody, which we then followed up with telephone or video interviews with a small number of people who had filled in our survey. They need to get practical solutions to some of their problems, some of the difficulties they face. So we organised a roundtable discussion with carer organisations and local carers, and we discussed the issues faced and the types of support that they need. Carers Oxfordshire has started a new carers service where they're going to provide a one-stop shop where people can contact them for tailored advice and support, and we're going to be monitoring that as the year goes on to see how well that service is running.
From Healthwatch Oxfordshire.
Hello.
We're currently running a project of what it's like living in the Didcot area in 2020. So despite the COVID restrictions, we did actually manage to get out and do some outreach work. We went over to Didcot. We managed to talk to people. We handed out surveys. We also ran an online survey as well, so it gave people a different opportunity to fill in the information. So we heard from 146 people who were actually positive about living in the area and being able to get information how to access services. We did hear from about a quarter of those people that they did have issues getting GP appointments. And there was also a small percentage, about 15%, who commented that there wasn't a lot for young people and families in the area as well. So what are we going to do with that? We're now going to take that report to organisations in the area for them to see what we've heard. So in December 2020, we actually ran our first webinar for PPGs to attend. It was really well attended with over 100 PPG members, and they came to listen to the Oxfordshire Clinical Commissioning Group talk about what was a timely subject with the COVID vaccination rollout programme. It gave them the opportunity to listen and to ask questions on that subject. We are now running monthly PPG webinars around subjects that the PPGs are interested in.
This has been really important during the pandemic because a lot of local services have been operating very differently and access to those services has been limited. I think in the last year we've actually helped 147 people signposting them to the help and advice that they need. Most calls we received were around access to GP services, access to NHS dentistry and COVID-related queries. So one signposting example, we were contacted by a gentleman who was trying to access GP services. So we actually sent him a copy of our Access to Health card, which is just a very small pocket-sized card that we produced. And it was just telling him exactly what he needed to register with a GP. And he didn't need proof of identification. He didn't need proof of his address. So, that was a success story, that helping someone to access a service that they needed. We also have 6 volunteers who work with us supporting our outreach, admin and research functions, and their help has been absolutely invaluable over the last year, so we would like to thank them very much for their support.
We are going to continue to work alongside communities and go into local communities so that we can hear what they have to say. Not everybody has access to the internet, not everybody uses the internet, and there are barriers. Our second responsibility is to make sure that voice is heard around the table where people who pay for services and deliver services. I'd like to say a really big thank you to everybody who took time to talk to us and fill in our surveys or even just talk to us directly. I'd also like to say a big thank you to everybody who works in the commissioning services or in trusts who have listened to what we've heard from you, and that has made a difference to how they think about services and developing services, and we want to continue that. I'm back, I think. Yes. Right. So, well, thank you very much. I hope you enjoyed that and the popcorn lasted. What I'd like to do now is really, as you will see from the film, obviously we've not been able to cover everything in the film. Oh, Skype for Business is opening. Why be that? Sorry. Can you see? Got a problem. That we haven't covered everything. So I'd just like to take you through a few slides that detail some of the impact and outcomes that our work has achieved over the past year. And I've been allowed to be in charge of technology again. So I am going to do that by sharing my screen. Sorry about this. Talk about yourselves.
I thought it was a really good film. Should be handing out a few Oscars there for some people. I really enjoyed it.
Thank you.
to Zoom, share screen. There we go. Can you see that?
Yeah.
Yeah, yeah.
Right.
Yeah.
So can you see the whole slide? There you go. So as I said, I'd just like to go through a few of the outcomes and impacts of our work over the last year. Being heard is a key thing that we want be tasked with, and that we really value being able to achieve that. And that means having the voices heard of the community at decision-making tables. And interestingly, we were contacted by the NHS and Ipsos Mori, who were doing some research around health services, and we linked the local voting community into them, and 5 members took part in that research, which is absolutely brilliant. It means their voices were heard. During COVID-19, it came to our attention that some members of our community, particularly within the asylum community, were finding it difficult to access vaccination. And so we linked them in with Luther Street Medical Centre, who expanded their offer to this community, which was absolutely wonderful. And many members of the asylum community were able to have a COVID vaccine when they perhaps might not have been able to have one. The emotional Wellbeing of Under 5s report was used by Homeside Oxfordshire to help develop its support for families during the pandemic, and they've used it to develop their services as well. And our feedback centre, which you will see if you visit our website, where people leave feedback on specific services, we've continued to focus a lot more on making sure that when people leave feedback, that service providers hear it, see it, and also respond, and that is working really well. Influencing services, sometimes little changes make a huge impact on people, and we heard very early in COVID that the Oxford Clinical Commissioning Group's phone line wasn't actually working, so we were able to manage to get hold of them and tell them that people won't be able to get through to them to seek advice about COVID or to make complaints during the early months, and they made that change very quickly, which meant that people were able to, from very early on after they heard from us, to do that. The General Pharmaceutical Council took our report on people's experiences using pharmacies during COVID-19, and we're looking at it to help identify ways in which it could, as a regulator, and that's what's really important, to improve people's experiences of accessing local pharmacies. Little changes again. It became obvious that it was difficult to find information about maternity services, especially about visiting during COVID. From going into the OUH's website, and as a result of us bringing that to their attention, they made that information more accessible, which has a huge impact on people, families during the period of giving birth. We had an interesting one early on when it was brought to our attention by members of the community that there was, I can't say any other way, but an offensive poster being used to promote the NHS health checks for men. We drew that to the attention of Public Health Oxfordshire, and they very quickly withdrew that from the local community. So, you know, it's little things that make a difference as well as big ones. We're proud to say that OUH, Oxford University Hospitals, listed our COVID webpage as one of 6 trusted sources of information to which they linked people, which is very, very pleasing. And we also took it upon ourselves to make sure that we improved our website. We improved the content and structure and design to make it easier for people to use. And we also added a range of translated materials and information at the beginning and during the first sort of 6 months of the pandemic. Involving people in service design is a key element of what Healthwatch is about. And following on the initial findings of the community wellbeing research conducted jointly with Oxford Community Action, mental health first aid training course was established by Restore for members of the minority ethnic community. And to date, I know of at least in that year, at least 14 people who've completed that training. We also secured agreement that carers will be involved in monitoring, development and evaluation of the new carer service that you heard about earlier. And the Oxfordshire County Council, in response to our report on the implementation of their changes in contribution policy for financial assessment, committed to use the information in the report and any other feedback they get back as part of future policy reviews. So people's voices are making a difference. People's voices are having an impact on services, sometimes very little, but a big one for individuals, sometimes potentially quite a big impact. In the film, we referred to working alongside communities, and I'd just like to give you, because obviously I'd like to just give you a quick idea of the range and number of different communities we've worked with over the last year. And it's just a very short slide, which I'm now I'll be very good at this at the end of this meeting, sharing my screen. So can you see, I hope you can see that. So we've worked with many different communities across the county, and for lots of different reasons. If you we talked already about the work that some of the work we're able to do with asylum seekers and refugees. East Hagbourne Parish Council is an interesting one because they supported us in the work that we were doing in Didcot to promote information. Good Food Oxfordshire, we seconded a member of staff early on in the COVID pandemic area to go and support and do some work there. Great Western Park Residents Association again worked with us on the Didcot project. And then there's, we also seconded someone to Oxfordshire All In and have continued to work alongside them. Sophia is another one that in Didcot we held a pop-up event there to talk to people and hand out information. And there's all sorts of other things that we've done with different groups. This is just a sample of organisations that we've worked with over the year. I think you're here, aren't you, Nuha? Hi. Yes. I mean, yeah. So as you said, and then it said in the film that we've now recruited an outreach worker to bolster our resources to be able to work out in lots of different communities. And Nuha, I'm pleased to say, started with us earlier this year. And I just thought I'd give you an opportunity just to say a couple of words about what your job is and what your hopes are for the year coming, really. Thank you.
Thank you very much. As Rose said, I just started this role. In my role, I will be going to visit community in their place and hearing from them, listening to them, and bring different issues and look at this issue if we see it is like common issues. I mean, I started March, February was my instructor, March. And we did some jobs with different Arabic speakers, people, and with different communities. I mean, it is very interesting to listen from them because they don't use a lot of service in NHS, which is I mean, in our job, we should listen to them and see how we can help them with all NHS service and all our colleagues in different departments. Yeah, I mean, I'm so excited about this role because it's like I always feel it is very important. I mean, I by myself, I'm from different community. I'm not like English, and I always was wondering: is different communities are really using different service and NHS and social service? And my background is social service, and I never see, I mean, I work with different community and I never see they are using this service in proper way. And I'm really aiming to help and reaching these communities. Yeah,
thank you very
much.
Thank you very much, Nuha. I put you on the spot there, but thank you. So once again, I'd like to just thank our great team, our staff, our volunteers, our Healthwatch ambassadors who sit on the Health Improvement Board and the Children's Trust Board, and our dedicated trustees, without whom none of this would have been possible. And I think everyone should give themselves a pat on the back. We're now going to open the meeting to questions, conversation. Just stick your hand up or wave at us, and one of us will be able to point you in my direction, and I'll be able to call you in. So thank you very much for listening. Thank you very much for being here. I'm going to take silence if you're not quick. Yes, Dan.
I thought I'd be first. Thanks very much for that. It's all been very interesting, and clearly you've done some fantastic things, particularly reaching out to people who are hard to reach. That's fantastic. I wonder if you could give some discussion of some concrete improvements that you've seen in health services because of your interventions. And it's very easy to go out and talk. Well, it's not very easy at all. It's very difficult to go out and talk to people, but it's clearly very important. But what concrete improvements have there been in the provision of health services in the county?
I think that's a really good and really challenging question as well, because there are lots of different ways that services improve, and quite often the big improvements take a long time to come about. So quite often we see changes in services that have been looked at, discussed, researched in previous years, rather than ones that have happened in this year. I'm not going to be a politician and avoid your question. I think, but what I will say is COVID threw everyone a curveball. And so when things that were beginning to be discussed and changes that were beginning to be made at the beginning of last year, actually everything apart from the system responding to COVID and getting better at responding to COVID, I think stopped, I think it's fair to say. So in terms of immediate impact last year, it is the little things that we can talk about. And so I've talked about a few of them already, but major changes, I can't think of any major change that I could put our hand up to and say it was because of us, because quite often it's a contribution of many things. I think what I would say is that one of the changes that's happened in services is that because of our effectiveness of getting people's voices heard around the table, not just in public events at the Health and Wellbeing Board and Children's Trust Boards, but at other tables that we sit at the clinical commissioning group, for example, that the system is to listen more to people and responding better. The other thing is that a lot of the immediate changes come, to be honest, from enter and view. And that's where Healthwatch is able to make its greatest immediate impact on services. And enter and view, which we didn't really cover at all, I don't think, was put on hold, mainly put on hold last year. And that's our power to go into any any service that is in receipt of NHS funding or local authority social care funding, and to enter it and view what's going on. When we do that, we go in and we talk to people who are using the service, we talk to staff members, and we observe. And when from that, we then produce a little report which will talk about things that can be improved from our observation, but also from what users have said. And more often than not, those changes happen very, very quickly. Unfortunately, enter and view was put on hold by us as well, because we weren't able to go into places during COVID. However, we did manage to do one enter and view last year, where we went into the Kasam NHS vaccination centre in Oxford, which was a fascinating experience. And I think the one thing that came out of that was that most of the people who had attended that centre for the vaccination were really impressed about how well organised it was, how safe they felt, and that the staff were really kind and gentle. We did identify one or two things that staff raised with us that we put in the report, and the Oxford Health, who have responsibility for delivering this on behalf of NHS England, were able to address those issues. So I think I've waffled a bit, but I think last year is a difficult one. It is about access. I would say the major thing that we've managed, the major impact we've had is about enabling people to have access to information, access to services, and be heard around the table over the last year.
Could I jump in, Ros?
Yeah, Julianne. Yeah.
I'm Julianne Howe. I'm one of the senior commissioning managers. I work in the transformation department across primary care in the clinical commissioning group. And I've always been an advocate of the patient voice, but one of the things we really appreciate is actually having the focal point of Healthwatch to be able to go to know Ros, to know other members, to be able to say, oh, we need this or we need that. Who can we turn to that will help us with this sort of work? So an example is two of the projects I've been working on through COVID as well one has been population health management, which is a new way of working in the health service. And I've been in quite some time. And this is about actually reflecting on the populations that we've got and specifically drilling down into particular cohorts of patients and saying, what can we do to help these people? And in the past, when we've looked at data, it's sort of been, oh, it's primary care GP data or it's hospital data. We're now working hard to actually join the sources of data up so we can see a patient's journey through the health system and be able to say, well, how can we actually help and support this person? And a number of our primary care networks have come forward. We've had 3 in wave 2A and 3 coming in wave 2B. And they have been looking at their issues that they might have or the areas within their data that are highlighted and decided, right, we'd like to do something on X or Y. And they've been able to take that forward. And because Healthwatch have actually been present and come forward in the place-based events we've had in Oxford, because this population health management is across Buckinghamshire, Oxfordshire and West Berkshire, Healthwatch have stepped forward with this now. So what I'm finding is with the practices who are involved in wave 2B, they're saying, well, who else should we have in our action learning sets? Can we actually get Healthwatch involved? So they want to have the patient voice involved as well, which has been fabulous. Second example is something your chair is involved in, actually. So after this meeting, Sylvia will be meeting with myself and another one of your Healthwatch members. And the CCG last year produced a very long and dry primary care estates strategy. And we recognized that it needed to be done in the way it did because it has to go out to planners and councils and be looked at by developers, and it needed a lot of quite complex sort of discussion within it. But we knew it was not fit really for public consumption. And although we posted it up on our website, we wanted to have something that was more accessible for the public. And that's where Sylvia and Maddie are coming in. And we've got a meeting after this meeting to look at producing something a lot shorter and a lot more succinct that will help us take a message out on a wider public scale. So I'm really grateful to have their input to that as well. And I'm sure there's other projects my colleagues are doing, but they're just from me at the moment because I'm on and can tell you. So thank you.
Thank you very much, Julianne. Ian, sorry, just go back to Dan. Do you feel you've had a sort of answer?
I've had a sort of answer. Yes, thank you. If I could just make one other comment since you asked me. I'm a counsellor, as many of the people on this call are, and I periodically get approached by people who've had mental health issues,
yeah,
and have felt stuck between the various bodies, be they the hospitals, GPs, CAMS, the sort of rushing out health people, and I felt very lost in the middle of it. I just wondered if that's a common experience that you come across.
I'll let Carol answer that, as she tends to be the front of house in terms of most calls that come in.
Hi, Dan. Can I just go back to your previous question where you talked about the impact of our work? So I think, as Ross said, sometimes it's a long time between producing a report and the piece and a difference being made from that report. So I can say that about 4 or 5 years ago, we did a piece of work on female genital mutilation. It was a project we did. And that project was well received at the time. But then about 2.5 years later, I had a call from someone at NHS England, and they were doing some work around that subject and some policy work. And they wanted a copy of our report to help inform their work. So we were quite lucky that we knew that that piece of work then was raised at a really top level, but it did take 2.5 years to get there. So, you know, sometimes our work does have an impact. We don't always know about it, but sometimes it is 2-3 years down the line. So just to answer that question, just to, you know, give you that piece of information. The other thing is, I think that, you know, mental health is difficult for people accessing services, is, you know, the feedback we're getting. And I think one of the challenges people are finding is getting some advocacy services. So, you know, if you have a child who has, you know, is looking for some support and an advocate for your child, it's very difficult to get one. And I do think that people do find that they're having to go from service to service and explain their situation. I know that the Mental Health Partnership, you know, the Mind and Restore, you know, there are some really good advocates there that, you know, people have, you know, have really had some good service and good support from those organisations. But yes, I would say that people do find there are barriers to access, whether it's waiting times, whether it's advocacy, there are barriers to access.
And we picked a lot of this up, not last year, the year before, in 2019, when we did when our theme was mental health across the whole of Oxfordshire, and the issues around accessing services, waiting times, being bounced around between services, and having to repeat your story, and not being able to receive the service that you're expecting is explained and highlighted in there, if you want to pick that one up. I think it's worth saying on this, Dan, and I'll come to you in a minute, Ian, is that Healthwatch Oxfordshire isn't mandated to work on behalf of an individual. Our job is, when individuals approach us for help, is generally to understand what their concern, what they're looking for, and to be able to point them in the right direction, link them in, whether it's give them the information or whether it's make that connection between the individual and the different service, so that they hopefully end up at the right place that can actually support them through the system. That's often very challenging for us, because obviously we're human beings and we want to look after people and we want to make the world better for individuals. But the best thing that we can do is get them to the right place. And when the right place doesn't deliver, or there isn't something, then our job then is to really sort of say to the system, look, you know, we're getting 6, 7, 8, 10 calls from people who need this particular service, and there isn't anything that we can send them to. There's a gap that your community in services that needs to be filled, and take it on that. Okay, thank you, Dan. Ian, welcome, Ian.
Yes, good afternoon, and thank you very much. Very, very interesting presentation. I'm actually chairman of a support group for myeloma sufferers, which is a rare form of blood cancer.
Right.
And I was wondering how much work you do with specialist support groups, and you know, whether there's something that we could perhaps sort of do to sort of get more involved in your work, and you can do to get more involved in what we're trying to do.
Absolutely, really great question. And you call yourself support. Well, I always think it's self-help groups. Is that self-help, self-support, support groups?
I mean, the group was set up because, you know, well, for two reasons really. I mean, first of all, myeloma is quite a rare cancer.
Yeah.
And people often confuse it with a melanoma, which is a totally different animal. So really, it fulfills two functions. First of all, anybody coming along to it doesn't have to explain what myeloma is. And secondly, you know, when you're diagnosed with myeloma, it's very easy to feel very alone.
Absolutely.
And then you're in a room with other people who are in exactly the same boat as you are. So I think it has two quite valuable roles.
Yeah. I mean, in answer to your original question, we're more than happy to meet with you, meet with any group. We're not, we don't ask for groups to be formally constituted or charities or anything like that. And I think my personal view is that self-support groups, support groups like yours that are focused around a specific, it might be a medical issue or condition, have a wealth of knowledge and experience that the health system or other systems can learn from. And so, yes, I mean, do get in touch with us, and we'd be more than happy to have a chat, either on using lovely Zoom, as I call it, or we are about to go out and about in the big wide world again. So, you know, definitely on Zoom or telephone. So why don't drop us a line or pick the phone up and ring us, and we'll arrange a date.
Okay, thank you very much.
Pleasure. Jenny's waving at me. Jenny Hannaby.
Sorry, I've lost my little hand that goes up on the Zoom on this one. Yeah, well, hello everybody, and I think Sylvia I know, and Rosin and a few of the others. So thanks ever so much for what you're doing, Healthwatch, and all your volunteers. Great work you're doing. Rosin, obviously you are now Healthwatch is now starting to sit on many of the committees that are starting to form round health and well-being and things like this. So you're now got an official seat at the table, etc. And we've got Bob, ICS Bob, coming up, and I believe you've also got a seat at the table there. And I'm just wondering, because there's always been this sort of independence and impartiality that Healthwatch took over from the patient's voice, and I believe you've done a great job there. How do you see your role now, as you are now sitting at the table with votes, etc.? How do you see that carrying on in that way? How do you see Healthwatch evolving to help more with the new health services to make sure that there's a smooth pathways, and especially GP services, which really are falling apart, I think, at the moment in some areas?
Thank you, Jenny. If I take this first, and then I'll hand over to Sylvia because she sits on the Health and Wellbeing Board. I think, I mean, just to answer your question, the Health and Wellbeing Board is the only board we sit on where we have a vote.
Okay, thank you.
So, and to say something that puts that in context, we're fiercely proud of our independence, and it is at times a difficult tightrope to walk along, because we have to be able to hear people. We have to be able to give an honest, independent voice back to the system, but we also have to have a decent relationship with the system to be able to be heard. So it is a really difficult one.
Yeah.
When we sit round tables, whether it's at I don't know, CCG, clinical commissioning group committees, or in the future how Bob might involve Healthwatch in their committees or groups, we would normally sit as in attendance. So we're playing the two. We're in the privileged position of being around the table, so we can bring that voice. We can tell those people who are making the decisions what we're hearing, but we can also at the time, because we're around the table, challenge them to remember the voice, remember listening to the patient voice and the user voice, and to also challenge stuff that's going on. Without being around that table, it's really difficult, or it would be harder. So I understand your question. How do we retain our independence? We're not going to give that up. But I think it's important that we are around the table in different places, as long as people understand. And I suppose that's up to us to make sure the population understands what we're doing there, why we're there. We're not there because it's a club we want to join. We're there because it's a place that their voice will be heard at. And by an independent way. I don't know, Sylvia, if you want to come in, being a member of the Health and Wellbeing Board.
Yes, well, I attended, hi Jenny, I attended my first meeting a couple of months ago, and I see very much as you're listening, but just still the critical analysis of what's going on and asking the awkward questions. And I don't think we should ever shy away from that. That's what I feel we should be there for, to ensure that if something's not been addressed properly or it's been glossed over, then we go back to it and ask the question that people would maybe like to ask but don't. Even though we're on a committee and got a vote, I'd still want to not be the most popular person maybe on the committee.
Yeah, thank you. That's really heartening to hear, because we've so much change, and we really do need Healthwatch with their independence and to go in there. And I'm very pleased you're able to go into places now. You've been given that, because that's just another form of monitoring that's vital. I think for the population, who I'm sure will be getting very puzzled about what's going on in their health services in the next few months or years. Thank you so much, all of you.
Absolutely, thank you, Jenny. And you know, we wouldn't say anything less here at Healthwatch. It's been frustrating for us over the last year, but it hasn't stopped us from going out. What it has done, to a certain extent, stopped us from going into places where they could, because of COVID, not want us, and that's always been a concern. We all know, you know, CQC stopped going into places on a regular basis as a normal basis. So, you know, it's so important to have that eye, independent eye from outside. And we're not inspectors. We're not inspectors. We're people who can bring in that sort of independent view, outside view, that can speak frankly with service providers and be heard in confidence by service users and members of staff. So we're looking really forward to being able to do more interim views. We're looking forward to being back in the hospitals, doing our pop-up scans once a month, and anything else. I mean, we already have been out this year at 1 or 2 community events anyway. I mean, our view is, if the community's out, why are we sitting at home? You know, we have a job to do, and our job is best done. And the quality and the wealth of information, knowledge and trust that you build up in communities, really, you can't replace face-to-face. Safely, securely, socially distanced, masked up, whatever, we need to be out there.
Well, I hope in my role we'll be able to have a chat and etc. and keep together adult social care. So
thank you very much.
Thank you, and thank you all again. Bye now.
Bye. Helen.
Yeah, thank you. All very interesting, and I'm really interested in the work you're doing with the patient participation groups. I'm a counsellor and I'm relatively new trustee to an organisation called Healthy Abingdon. And I understand we're covered by 2 PCNs across Abingdon, but we don't have any patient participation groups. How do we change this?
Well, I thought you did have sort of maybe dormant patient participation groups.
I've been trying to
quietly sitting in a corner there. How do you change that? The simplest answer, which might or might not get you anywhere, is you need to talk to your GPs and work around how that. But the other answer is come and talk to us. We'll drop us a line, and either myself or Emma will have a chat with you and talk you through that process. There's lots of different ways of creating patient participation groups, and not just that. The role of patient participation groups is fundamentally to be another ear for the practice patients and have that direct access back into the practice, into the GPs, into the practice manager, so that they can be a critical friend and a support for the people, for the practice. And there are quite a few patient participation group members, I think, around the table at the moment. So I'd be waving at Darlene and one or two others. Yes. So I think, you know, it's give us a bell and we'll help you.
As you say,
Yeah,
maybe
that's our job.
we're dormant and that we need to get going. But you know, this is really sort of part of the sort of Healthy Abingdon.
Yes.
Remit, really. So,
yeah.
Thank you.
Thank you. Rupert's waving at me.
Yeah, Rosalind, thank you. Interesting expose. I'm a new councillor, so apologies if my question's a bit naive, but I'd just like to understand how you're funded.
Okay, so Healthwatch is, there are 151 Healthwatches across the country, and we're all set up. We've been established by the Social Health and Social Care Act 2012, and part of that ensured that every top tier authority had a Healthwatch. The money comes from the government to the county council, and we have a grant and aid agreement with Oxfordshire County Council. That's how we're funded. The next question is, how do you retain your role as a sort of influencer and challenger to local authority social care services when they're paying your bills? Is that the next one? Because that's the question, the follow-up question I usually get. So I'll just cut to the chase on that one.
Sure.
Pardon?
I said yes, sure.
Yes.
So that one.
We've been very clear that, as I said earlier, that our independence is sacrosanct. And so there is a huge 6-foot thick wall between the grant and aid agreement and the reporting that we do against that to the work that we do around local authority social care services. As with any service provider or commissioner, we're always open to people coming to us saying, we'd quite like you to have a look at this service, as much as we're very open to hearing from half a dozen people who will have a concern about, I don't know, for example, it might be a day centre, and we will make that judgment call about where we put our resources and direct. So we're not directed by the local authority as to what we do, even though we have a grant and aid agreement with them, because it's very separate from the independent operations of Healthwatch Oxfordshire.
Okay, thank you very much. Appreciate it.
Thank you. Joan.
Hello.
I have a hand. Hello.
Forgive me if I misunderstood Helen on Healthy Abingdon. But I'm on the Abingdon Surgery PPG, and Dave Butterworth is a member of both. Have I misunderstood something?
No, I understood that. I don't know if she's still online, is she? I can't see her. Helen, you still there?
I'm still here, yes. Yes. No, I was just going on something that David said in passing, and I sort of thought I'd ask the question, and then I will talk to Dave again, yes.
Oh, have I misunderstood something?
Talk to Joan as well.
I will do, yeah.
One of the many roles that we play at Healthwatch is as marriage brokers and all that sort of thing. So I'm very pleased that we've managed to put Helen and Joan in touch today to be able to talk about PPGs and Abingdon.
That's great, thanks. Yeah.
Thanks for that, Joan.
Thank
Good
you.
to see you. Yeah. Anyone else? Oh, Andrea, I can wave back. Hello, you're on silent, on mute.
Am I on mute? Hello. Well, I haven't got a question. I just want to say thank you. Thank you for helping us with the PPGs and DigCart and everything you've helped towards. I was trying to get a foot in the table to speak to people and just sort out some of the medical infrastructure that we're trying to work on. So from the PPGs that I work with, and I'm the chair of one of the GP surgeries, I work with the other two in DigCart, which you know, but I just want to say thank you for, what you said. Thank you for the presentation and just for being there to facilitate the different avenues we can go through that we've been through. And it's been really good. Thank you.
Thank you very much, Andrea. I mean, it was a pleasure, and I'm sure it hasn't finished yet. Just to broaden that out to the rest of the room, one of the other roles that we play is a broker between groups, organisations, PPGs, and the system. So we're able to, because we do have that round the table approach and those connections, quite often our role is very much to, as with the PPGs at DigCart, put them in touch and broker those meetings with CCG. It might be, we had a much bigger one in the end, didn't we, at DigCart? But we also, we do that for individuals with services, and we do that for groups with different parts of the health and social care system. So thank you very much for that, Andrea. You'll hang in there, it'll happen in the end.
We will.
It will.
Thank you.
Okay. Anyone else? Right, well, I'll take silence as satisfaction. Once again, I'd just like to say thank you very much for everyone for coming, and I'd just like to hand over to Sylvia, and thank you for your questions. To Sylvia, just to wrap up. Thank you all.
Thanks, Ros. Well, I think we can all see that the Healthwatch has been very busy in the last year, and I hope you've all learned something from the last hour or so. Can you please share this with everybody and anybody that you know, and spread the word how good Healthwatch is? Nothing to do with me, I don't do anything, but the team at Healthwatch are just brilliant, and Ros is an excellent leader. So thanks for coming, and encourage everybody to look at this video, look at the report, and thank you very much.
Thanks a lot.
Bye-bye.
Thank you.
Bye.
Right, I'm just stopping recording.
Oh, brilliant.
Well done.